Hello, thank you for joining us for Unite for Sight's webinar about applying lessons in cultural competency. We have more than 800 participants in today's webinar, and we are thrilled to have all of you here with us today. My name is Jennifer Staple-Clark, and I'm founder and chief executive officer of Unite for Sight. So I'll start by briefly introducing you to Unite for Sight and our various programs, review the webinar logistics, and then we will hear from our expert panelists. Unite for Sight is a global health nonprofit organization that promotes high-quality care for all, and we have a number of extensive global health and social entrepreneurship education programs. Our Global Health University program, for example, offers a free webinar series, including today's webinar, and we also offer 20 online certificate programs for students and professionals. And many students receive academic credit for completion of our certificates, for example, and many professionals complete the certificates for professional development purposes. And the certificate topics range from a certificate in global health and a certificate in global health research to a certificate in cultural competency. And we have more upcoming webinars already scheduled during November and December, and we are currently starting to schedule them for the new year as well. And we encourage you to register for all of our free upcoming webinars at uniteforsight.org/webinars. We have one about research monitoring and evaluation coming up in 2 weeks, and then another about environmental contaminants in December. Additional educational opportunities for both students and professionals includes participation in Unite for Sight's annual Global Health and Social Entrepreneurship events, which focus on responsible global engagement. Last week, we had our 3rd annual Social Entrepreneurship Institute, and upcoming now in April, on April 16th and 17th of 2016, we will have our 13th annual Global Health and Innovation Conference. So definitely save the date, and we are currently accepting abstract submissions on our website, as well as registration for the event at uniteforsight.org/conference. In addition to these educational programs, we also have healthcare delivery programs that provide care to patients living in extreme poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. And these programs are locally led and managed by the local medical professionals. And this collaboration has provided eye care to more than 2 million people by the local doctors during the past decade, including more than 90,000 sight-restoring surgeries that are all done by the local ophthalmologists. Unite for Sight is the world's only organization that is both a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals, and the program is very focused on cultural competency. Participants support and learn from local doctors in Ghana, Honduras, and India as those doctors provide care to patients living in poverty in villages, slums, and refugee camps. And the participants learn from those local doctors about barriers to care and about effective strategies to reach the hardest to reach patients and reduce the barriers for those patients. And the local doctors are phenomenal entrepreneurs who design effective and innovative strategies to eliminate those various barriers to care. So now that I've described a bit about Unite for Sight, I'll now describe the basic logistics of this webinar. And we're thrilled to have all of you with us here today. We have 5 incredible panelists, and they have a wealth of expertise to share with you during this next hour. Each of the panelists will give a 2-minute introduction about themselves, their current role, and their key lesson learned about cultural competency that they wish they had known earlier in their career. And then we'll dedicate the remaining time to your questions and answers. And we received many excellent questions already from you, our audience, by the question submission deadline this past Tuesday. And we selected the most common and most thoughtful questions to ask our panelists, and those questions are already in our queue. But we also invite you to submit additional questions today in the text box on the left of your webinar screen. And then we'll select those additional questions to ask the panelists today as well. And we also encourage you to tweet about the webinar, including your key lessons learned by using the hashtag GHGWebinar. And you can see that hashtag in the webinar visuals on your screen. Now we'll proceed with having our panelists introduce themselves in alphabetical order. And I'm delighted to introduce you to our first panelist, Dean Cycon. Dean, if you can please begin by introducing yourself and your current role, and share your key lesson learned in cultural competency.
Certainly. Thank you very much. I'll get right to it. My name is Dean Cycon, CEO and founder of Dean's Beans Organic Coffee, 23 years social enterprise in coffee and social justice around the world. I began as an indigenous rights and environmental lawyer and had years as a community organizer in indigenous communities around the world, continued that with Dean's Beans. Our model combines fair trade commerce with social, economic, and ecological development based on the goals and values of the communities we work in. I think we often make a mistake in thinking that our technologies, our programs, and our approaches are value neutral, that somehow what we do comes on a blank slate. They do not. Everything that was ever invented comes from somebody's mind and comes from somebody's culture. So it's really critical to be able to identify your own cultural imperatives and what then you're coming up against in the communities you're working in, especially with indigenous communities, because the dynamics of oppression and control in those communities relative to their own national state rather, not even thinking about the international community, are really fraught with problems. So I think that the key is to structure your programs and reconsider your technologies for local empowerment, management, and ownership, rather than the creation of yet another level of hierarchy on top of already oppressed or marginalized peoples. Okay? Some quick takeaways: learn some language. Language breaks down hierarchical barriers. Simple few words in any language goes a long way. Humor and self-effacement. Humor is universal, included in your communications with people. I'll stop right there.
Terrific. Thank you so much, Dean. And Paul Ellingstad, if you can also please introduce yourself and share your key piece of guidance as well regarding cultural competency.
Sure. Thanks, Jennifer. Delighted to be joining the panel tonight. So I am the managing partner of PTI Advisors, a newly launched social innovation consultancy. I've spent my career to date in the IT industry in the private sector, and over the course of the last 6 years have made social innovation my full-time job. And now I've made a pivot from working from inside of a corporation to now consulting to other corporations as well as to governments and NGOs on how to build social innovation partnerships. It's been, I'd say, an interesting journey of learning for me in terms of cultural competency. And a couple of the key takeaways, I would say, first of all, it's a continuous learning process. And the types of projects, the types of partnerships that I've been involved in, I've also realized, these are not sort of static situations. It's a very dynamic environment that we're living and working in, and you need to constantly be checking your own assumptions. I think building on what Dean had said, about values, coming from somewhere and from certain beliefs, we need to constantly be checking our own assumptions, our own beliefs, as well as what we think of, our partners and the others that we're working with. Just one quote around this that I think really encapsulates, the cultural competency for me. A colleague shared this with me from Lao Tzu. Go to the people, live with them, learn from them, love them, start with what they know, build with what they have, but with the best leaders, when the work is done, the task accomplished, the people will say, we have done this ourselves.
Terrific. Thank you, Paul. And Marie Martin, if you can also please introduce yourself and also share your key guidance.
Wonderful. Thank you so much, Jennifer. It's a pleasure to be here. My name is Marie Martin, and I'm the Assistant Director of Education and Training at the Vanderbilt Institute for Global Health, where I also co-direct our Global Health track for our Master Public Health program. And I have an academic background in international education and policy, and have been developing curriculum and academic programs for around 15 years now in the U.S. and abroad. And my work focuses on building human capacity to improve health outcomes in low-resource settings. And I seek to do that at 3 distinct levels. At the individual student level, to be more effective practitioners and leaders in global health, acquiring durable competencies and developing a strong toolkit. at the institutional level here at Vanderbilt to build high-level training programs in global health, and at the low and middle income country level, partnering to build capacity on the ground to effectively tackle health issues domestically. So my key advice in cultural competency, and I'll build on Dean and Paul's fabulous comments, but I will say that no matter how much you've traveled, worked, or interacted with cultures that are different from your own, it's important to recognize that none of us are ever as culturally competent as we may think we are. And since, as Paul mentioned, culture isn't static and cultural beliefs and behaviors are always morphing and changing, it means that it would be rare to reach some kind of competency based on singular experiences. So this truly is a lifelong process. And so that process needs to first begin with assessing and enhancing our own emotional intelligence. And that's been described in the literature as demonstration of competencies that constitute self-awareness, self-management, social awareness, and social skills at the appropriate time and in sufficient frequency to be effective in a particular situation. And so as such, approaching every situation as a learner with humility and respect is essential.
Terrific. Thank you so much, Marie. And Natacha Poggio, please introduce yourself as well.
Hi, everyone. It's a pleasure to join you in this webinar today. My name is Natacha Poggio. I'm a social impact strategist and educator. I'm originally from Argentina. Also, I'm currently an assistant professor of graphic design at Lamar University in Texas. And before this position, I taught visual communication design at the University of Hartford in Connecticut. In 2008, I founded Design Global Change, which is a design-based collaborative that uses a human-centered approach to address wellness, sustainability, and social justice issues for global health organizations. Some of our work involves educational materials on sanitation, gender equality, empowering girls' education, and also rehabilitation of amputees in developing countries. My students and I have worked with rural communities in India, Kenya, and South Africa, and learned valuable lessons in the field. Working with people from different cultures, a key lesson is how to give feedback. Depending if they come from an indirect culture or a more direct culture, the words preceding or following the feedback will soften or strengthen the criticism. I realize now that when I give feedback in my Argentinian way, which is a very direct, straightforward way, I may actually use words that make the message sound too strong without thinking much about it. But this could be understood as negative criticism and unintentionally hurt someone's feelings. For effective cultural competency, I believe it's important to understand how our words are magnified or minimized significantly based on our listeners' cultural context.
Great. Thank you, Natacha. And our final panelist, Jana Zindell, if you can also introduce yourself, please, and share your key piece of guidance.
Great. Thanks for having me. So my name is Jana Zindell, and I am the Chief Program Officer at Ubuntu Education Fund. And Ubuntu Education Fund is a South African organization. We provide 2,000 HIV-infected and affected children with comprehensive care and support from cradle to career. And we have come to a theory of change at Ubuntu that prioritizes depth over breadth, and therefore the Ubuntu model is place-based. We work with one specific community, and it's in this way that we feel we can have the maximum impact. So in terms of cultural competency, what I've learned is that it is counterproductive to pretend that an organization or a person active in the development sector will not have an influence on the culture where they work. I'm not South African, but I've lived there for longer than anywhere else in my adult life. I have spent 13 years on the ground in this one specific community where Ubuntu is based. And we can't pretend that we can leave things untouched and pristine. Our goals are to make change. And when attempting to make change, we will interact with the culture of a place. When I first arrived in South Africa, I was often nervous to contribute, and I was worried that I could cross boundaries or I would offend my colleagues. And it's taken a very long time. But now I'm confident that when I contribute, I do so as an insider. I have good ideas and I have bad ideas. We all do. So do my colleagues. These ideas need to be evaluated on their merit. The key is whether the foundational understanding is strong. So cultural competency to me is a framework established by ongoing long-term collaboration of a group. Those boundaries must be established and tested, and the proof is in that testing. The group and the framework must be strong enough to survive the test. And the indicator for competence is the survival of group bonds and that dynamic. We know we can't romanticize it. We've all been on family vacations, and human bonds can be easily aggravated even in the best of circumstances. Therefore, my advice would be to establish a strong foundation of trust with those you're working with, and then you can feel free to contribute to a joint culture rather than be preoccupied with offending or crossing boundaries. You'll make mistakes, but mistakes made within the boundaries of trust are learning experiences, while the same mistakes made between those that don't trust each other are offensive. Thanks.
Fabulous. Thank you so much, Jana, and thank you to all of our panelists. And as you heard, they have such a great wealth of expertise and guidance to share with all of you today. Now we'll proceed with the questions and answers. And as I mentioned, the questions were submitted in advance, but we are continuing to receive additional questions. So any questions that you have for the panelists today, please add them to the text box on the left of your webinar screen. So to begin, Jana, how do you approach a situation in which local perceptions or traditions conflict with or even hinder your personal beliefs?
I try to approach it with great care and respect. However, experience has allowed me to draw a line between my own ignorance or lack of understanding and when something is counter to basic human rights or is discriminatory or denies someone access to services like quality health care and education. We've seen throughout history that people use culture as an excuse to deny basic human rights, and we need to be very careful with these ideas and make sure that people are properly educated on their rights. In the past, I've seen my ideas and the ideas of my colleagues, my female colleagues actually, devalued based on a gender bias, and I was sometimes labeled as disrespectful for standing behind my ideas. And it was clear to me that as I was behaving the same way as my male colleagues, it was seen differently. They were labeled as leaders, and I was labeled sometimes as complaining or troublemaking, and it took years of conversations and arguments and policy change and education and more discussions, and above all, the trust for us to battle each other, but still respect and care for each other to make change. Today I see huge changes within our organizations. Like I said, I've been there for 13 years, and we've seen lots of change over that time. And that's within our community, from both the men who said these things years ago and the women who have stronger voices now. And when it comes to basic rights, I approach situations in a respectful way with reason, logic, and try to model for staff what I believe is right. We discuss some more, and sometimes we don't agree, but I can't sit back and watch culture being used to deny someone that equality and respect. So I retain the respect and the trust for everyone, and we engage in those behaviors, and we just talk, and that's how I approach that.
Great, thank you. And Natacha, how should health promoters and educators ensure that all messages are grounded in cultural competency and understanding?
I believe this is about understanding the cultural context our work is immersed in, be it in education or healthcare provider. Educators and health workers who have skills, knowledge, attitudes to value the diversity among their stakeholders, the community people they work with, will be able to contribute to a system designed to serve all the people well, regardless of the culture. I also believe that proper training is fundamental for developing this cultural competency to have a positive effect on patients or students by enabling these professionals to deliver services that are respectful and responsive to the beliefs and practices, the linguistic needs and the cultural needs of these diverse stakeholders. This relates to the idea of using cognitive components such as awareness, attitude, knowledge, and skills.
Great. Thank you so much, Natacha. And for our next question, how can visitors to a new community dissociate their own personal beliefs or biases and ensure that they truly listen to the needs and wants of the local community? And Jana, if you could please answer that one.
I'm sorry, can you repeat that? I missed that. Hello?
Can you hear me?
Yes, I can hear you now.
Great. How can visitors to a new community dissociate their own personal beliefs or biases and ensure that they truly listen to the needs and wants of the local community?
Yeah, that's a good question. And I'm not sure that anyone can actually ensure that. I think that people need to make sure that when they're coming into a setting that they're really, and to build on some of the things that my colleague said, that they're really trying to listen and be patient and understand that they're not going to know everything, they're not going to understand everything, and they need to build that trust. And they're going to make mistakes, but if they build that trust, they're going to be able to move forward. At Ubuntu, our model is a bit different because we focus on something that we call the build model, and this is a capacity building model that provides a framework for those who know the community best to also be excellent at their jobs. So when outsiders are brought in, they have an understanding of the value that we place on local understanding and knowledge, but it's a statement that we value cultural competency and local knowledge above any degree or experience, but also that we believe that they don't have to be, they might not have all of the knowledge, but we place that local and cultural competency above everything else. I think the bottom line is we all have to prioritize a long-term view of change instead of prioritizing speed, and training and career development is an approach to sustainability of cultural and professional competence, and that anybody who comes into that situation needs to understand that as well.
Wonderful. Thank you, Jana. And Natacha, if you have any additional thoughts about this question about how visitors to a new community can dissociate their own personal beliefs and biases and ensure that they truly listen to the needs and wants of the local community.
Yeah, I think that Jana answered very well, because it's very tough to accomplish this, as our beliefs and biases constitute who we are deep inside. In my experience bringing students overseas, I realized that the set of core skills that I want them to exercise are empathy and listening to the others. In the projects that I participated and I've been involved, we have been more successful the longer we have immersed ourselves in the community, the more interactions and being mindfully aware of why we are there. It has encouraged the students and even myself to know that they are constantly, we're only constantly learning things about the place, about the culture, the community, and this learning, we can use it to leverage the projects that we are set to develop with the community.
Can I jump in for a second, Jennifer?
Yes, please, Dean.
I'd just like to add, these are great answers, but I'd like to make a comment. I think that in the world of development, practitioners are like artists. Artists tend to fall in love with their models, and I think we do that too. And I think at our peril, we look at other people's cultural issues and then forget to look at our own. And I think Natacha was just starting to get to that point, that it's as important for us to identify what our cultural imperatives are and what our cultural biases are, not only what theirs are, so that we're understanding sort of the hypothesis we're in that community with. Because if we're not self-reflective and don't look at who we are, all we do is judge. And we can be nice and say, well, that's a stupid thing that they're doing, but I'm going to be generous about it. But you've already made the judgment that it's stupid. So I'm being basic, but I think listeners may be understanding what I'm saying. We really need to understand. This is not a academic exercise. We have to know kind of what our biases are before we can really understand what other people's are and how to interact.
Yes, you are so correct, because this is very hard to actually teach, especially when you are preparing a team of students to travel overseas into a community that they never experienced before, and where everything that they see is new to them, and they're making assumptions. So there's discussions that we do pre-departure, and then we have to continue doing while we are there.
and we do the same thing. Every night we come back and say, okay, what are our projections onto these folks? What's our gut feeling? Let's just lay it out, and then we'll look at how much of this is our stuff and how much of this is data.
Excellent. Thank you so much for all of your contributions. And on a similar note, Paul, while in a community other than one's own, what tools and practices do you suggest that one use in order to evaluate one's own cross-cultural understanding and engagement?
Thanks for that, Jennifer. So the first, I'm just going to go back, pick up on something that Marie had said, referencing emotional intelligence, or EQ. I think when we're talking about, cultural competency, EQ is a very fast-growing discipline that that's getting a lot of attention right now. There are frameworks, there are structures around how you can develop your skills in EQ, but I think some very, very basic ones that often get overlooked as being such common sense. Listening, observing. Again, I think we've heard from many on the panel here about humility. Respect, building trust. These are all things that don't happen overnight, and there is an absolute challenge, especially on shorter-term projects or deployments, that you're trying to compress, that trust building, and that education into a very small amount of time. So any opportunity that you do have, where you can lengthen the time, be present on site. I found from many, many experiences where, with the best intentions and briefings, over the phone or video conference, there is nothing, that replaces, the face-to-face, on-the-ground, shared experience. And so, if there are constraints in terms of, the time or the finances, I would say look for those opportunities around that, to have the, have the teams on the ground, with the communities they're trying to support.
Terrific. Thank you, Paul. And Jana, what are your recommendations for how to broach conversations about health topics that may be uncomfortable or taboo for different groups? For example, the importance of colon or breast cancer screening.
Yeah, another great question. The simple answer is very carefully and to have patience and to not hide. It's such an important topic, and I think it's too rarely discussed, at least where I am. Health issues and taboo seem to go hand in hand. And in all cultures that I've come into contact with, our bodies and our physical health, which are obviously essential to our day-to-day survival, are put at risk by our reluctance to discuss and address them. In America and South Africa, all over the world, people avoid going to the doctor, right? We live in denial of ailments and disease, and we'd rather suffer than discuss, disclose, or diagnose. In my 13 years in South Africa, I've seen really troubling things. I've seen our own staff members at Ubuntu who were HIV infected preach about the importance of disclosing their status and then not come forward. I've seen highly educated community members choose not to test for HIV or refuse treatment or refuse to even breastfeed because they don't want people to think they are HIV positive. And I've also watched some of these same individuals come forward over the years and become leaders in the field of education and change. For example, at Ubuntu, we recognize how important it is to provide pap smears. And pap smears in our community have been highly stigmatized. It took about 5 years for our own staff to fully come out and have pap smears, and it's taken about another 3 years of education to increase our uptake from literally 0 to about 20% of our client population. And I project that it's going to take another 3 years to get to about 60%. However, the subject of reproductive rights and the importance of pap smears, for example, is a real tough one. And to me, the main thing that has made the difference is having visible leaders who will take that first step. Pop culture, government, we need to destigmatize these things. It has to be seen as no big deal. These things have to be everyday things. We have to take that sting out of the words. We need to model the behavior and discuss those real fears behind the stigma and talk to children in an honest and sometimes difficult way. We need to use the words that cause everybody to cringe. We have to talk about penises and vaginas and AIDS and sex. And if we hide, they'll hide too.
Great. Thank you so much for your insight, Jana. And Dean, what are good ways to assess the cultural competency of an organization's staff, both organizations based in the U.S. that might work domestically or abroad, and also organizations that work abroad in particular local communities?
Okay, first things first, I really feel compelled to respond to Jana's comment just then. I absolutely laud and agree with what she said, but I'm going to use you as an opportunity to show an example of what I was talking about, is that sometimes we got to look at ourselves and look deeper at what we're involved in. Your comments about pap smears are, from a medical point of view and a standard medical performance point of view, absolutely right on target. But I got to confess, in our programs in Ethiopia and Peru and Nicaragua, where we don't use pap smears, but we use a different technology that's much more community-based and takes away both the fear and the overly hierarchical medical intervention, which often frightens women away or makes it difficult for them to participate because of distance and cost. So, again, my comment to this is not to diss pap smears or diss your organization, but to say that sometimes our assumption on what's the right technology to come into something, sometimes we have to look at it and say, wow, does this fit the culture and the capacity of the people we're working with? And I don't know what it is in your circumstance, but I know in Ethiopia and Nicaragua, where we've been working primarily, that's a real issue. Women don't get
absolutely. I want to make sure that I respond as well, because that is extremely important, and I couldn't agree more. And I'm not getting technical when I'm talking about these things, but we also use less invasive tools to do pap smears, and 98% of our staff is from the communities where we serve. So when I'm talking about an uptake going from 0 to 20% over 3 years, that's education and conversations coming from our staff, starting with our staff, getting them to do it on their own in a way that's culturally appropriate. And that, I couldn't agree more with everything you're saying. That's exactly how we do things at Ubuntu.
Wow, thank you. Okay, let me quickly move on to the question you asked then. I don't want like the Republican debates or something where I just say what I want to say. I think it's actually relatively easy to assess cultural competency in both your in-country and your expatriate staff, but you have to want to do it, frankly, because I find in most Western development organizations it's not really that big a deal. It's not considered a big deal. Maybe it's in the language, but in the behavior, I haven't seen a lot of it. Not that people aren't well-intentioned, but it's not like we're talking today about a proactive thing that you're looking at and consciously going into, with the kind of like the tools that Natacha's talking about. But I think for the in-country staff, it's if your staff is willing to talk to you and open up about this kind of discussion, I think it comes pretty obvious pretty soon where things fall. I'll give you an example briefly of a women's organization in India we had experience with, which was actually 4 women social workers and 1 man who actually was in charge of the whole thing, even though it was a women's health organization. And, frankly, the miscegenation and physical abuse that this guy was doing to the women was just off the charts, and nobody would say anything because he is, how they call him in India, he is sir. But when you talk to the women separately, they would share that what he was doing was wrong, it was inappropriate, it was ruining the program, so they know what's appropriate and what's not appropriate. But we have to be willing to ask the questions and ask them in forums and in ways that are people feel safe to share. A big mistake people make in development work is going and talking to people with the boss there. Nobody ever, even in America, nobody ever tells the truth when the boss is standing there. And it's very hard often for us to get to a place where we can sit with staff in a non-professional setting to have those kind of conversations. And that's where, going to people's houses or going out at night together has there's a space there for that sort of informal investigation of in-country cultural competency. I'll stop with it there.
Great. Thank you, Dean. And Paul, some people seem incapable of being culturally competent. They might think that they're being attentive to lessons in cultural competency, but their actions demonstrate the opposite. Is cultural competency an intrinsic trait, or can it be taught? And how can you ensure that all students or faculty in a program are demonstrating respect and cultural competency?
So first, call me an optimist. I absolutely think it's it's something that can be taught. Again, much like emotional intelligence, there's a model known as like the conscious competence model, and there's 4 stages to it. With skills in general, you go from unconscious incompetence, you don't know what you don't know, to conscious incompetence, through to unconscious competence, like breathing, for example. So, I think first and foremost, it's creating the awareness, and then understanding, what are the factors, for the specific situation that you're in, working through that awareness, the proper engagement. I think one of the critical things, though, is that, and maybe this is a little bit more, Western-centric or even American-centric, the cliche of, parachuting and getting business done, and getting out, being very effective. Having the time and, also engaging outside of the immediate, task or project or objective to be done, helps to calibrate, your understanding and your engagement, with the teams. I think also, in sort of a parallel to, say, executive coaching, or other professional development, to have, a trusted advisor, that you can use as a sounding board, to both elicit, feedback of how you're engaging, but then to also ask questions. I think that's another, technique that can be very useful. To the last question, though, of, how can you ensure students and faculty are demonstrating respect and cultural competency? I think the simple answer is, unless you're in a very authoritarian, autocratic sort of organization, you can't, necessarily guarantee that. I think the first step is, again, being very proactive in making your colleagues aware, and again, even within your own team, having the trust and respect, that you're able to, call out behaviors, and discuss them and modify them, rather than, again, being sort of awkwardly silent about, things that aren't going quite to plan.
Great. Thank you, Paul. And Paul, how do you suggest that you notify a coworker or someone you're working with who is culturally insensitive?
Oh, that's it's a tough one. I mean, I'd say overall, again, it comes down to personalities, chemistry, what the culture is within your team. I think as sort of a baseline, if you have, the appropriate trust and respect with colleagues, setting up a scenario, where you can just be very open, discuss the situation, and then, together talk about, well, is there a difference of view here? In other circumstances, and let's just be, realistic about, personalities in life, sometimes, I think as Natacha had said as well, being direct with some people will probably rub them the wrong way. You may want to, consider a softer approach. I think it's really down to, what the chemistry is, what the relationship is with the individual, dictates how you manage that and how you give feedback.
Great, thank you. And Dean, do you have any additional thoughts on how to manage that type of issue with someone you're working with who is being culturally insensitive?
Yeah, shame and blame don't work. There are a number of communication skills that are fairly well known these days. Conscious communication skills, they're called, and I think we need to embrace them. And those are making I statements starting with I, about I, not you, and contextualizing the situation. And as Paul said, sometimes I just had this situation recently. Sometimes you can go in there with the gentlest discussion, but, the way it's received is the way that person's going to receive it. And some people can hear it if it's not charged with shame and blame, but some people can't. And sometimes a person just blows up and gets angry if you even gently challenge anything about their behavior, and you have to be tough enough to stand your ground with that. And if that means letting someone go, you have to do it. These are management skills, and they're not easy for anybody, particularly a marshmallow like me, but you have to do them. So I think the biggest thing is being respectful and honest with people and making sure that your language when you're talking about these things is not shaming and blaming, but is informative and trying to look for a common way to resolve the issue.
May I add something?
Yes, please, Natacha.
Yeah.
So this is like something like, I learned from my students. They actually taught me about this idea of the compliment sandwich, where you start giving comments about something, in a critique for their work. And we start with something good, positive, then you will bring the things that need improvement, the shortcomings, and then you end with something positive. And that was something that I was familiar with because when I was in school in Argentina, we had a large classroom with over 30 students. So just the fact that the professor will have enough time to go over most of the things that were displayed during the pinup will be you will be lucky if the professor actually mentions something about your work, even if it's something negative. So my experience was that. So when I was starting teaching, I was going over most of the things that were the things that needed improvement, mostly because I wanted the students to come up with their best work. And as the students developed trust and felt confident about talking directly to me, they realized that I was willing and openly accepting their suggestions. And then they mentioned that. So now every time I'm giving feedback, I'm thinking of that. It's like I developed that as a practice, but I wasn't familiar with it. It wasn't part of my culture.
Wonderful. Thank you so much for everyone's insight on that. And Marie, what are the most effective ways to change the educational environment from a cultural competency view to a cultural humility view?
Thanks. This is such a good question, especially when we consider that, roughly 500,000 students in the U.S. are participating in anything from a structured study abroad to research to international internships. We really do have a role and a responsibility in the academic arena for, facilitating the right kinds of sensibilities. And so when I was thinking about this question, I was thinking about it really being understood at three distinct levels of the educational environment: the overall institution and the faculty administrators, and lastly, the students. So in thinking about how to foster cultural humility, just a few ideas would be that universities need to really reframe how they describe global engagement. This is not true across the board. Certainly there's some fantastic exceptions to the rule, but too often we really see reinforced notions of entitlement, especially ideas like global citizenship or this mantra of students to change the world, without a recognition of the value that's inherent in communities and what citizenship really means. So if we can imagine the role of our universities as one that encourages and trains faculty and students with the necessary and valuable human capital skills that are essential, but also with the sensibilities to function as learners and true partners. And that, I think, can be illustrated through long-term partnerships with organizations to sustain and enhance impact. So in thinking about faculty and staff, certainly teaching by example, so living out cultural humility in their own engagement with international partners. For faculty, developing rigorous training programs for participants and thinking about building emotional intelligence that's come up repeatedly, understanding students' agency and appropriate place and how to use that effectively, and lastly, increasing just a general intercultural competence in that dialogue, so integrating cultural humility the content into the discussions in the curriculum is really essential. And then lastly for students, and this has really come up, woven throughout this conversation, is that the prerequisite for any kind of successful engagement culturally is first to engage in self-reflection. I mean, without understanding our own cultural values, having a basic awareness of particular assumptions and cultural orientations, I think you're kind of dead in the water. So for students, it's this double-edged sword where you participate in an international program, and that's a great way to build cultural and emotional intelligence and cultural humility, but that participation also requires that you already have that in order to be successful. So some things that you can think about doing from a student perspective and that faculty and staff in the university can foster are evaluating and assessing your emotional intelligence before you depart. And I think Paul mentioned, some online matrices. There's certainly some questionnaires that students could take to better understand where they are and also recognize that it's a constant process.
Great. Thank you, Marie. And another question for you, Marie. What are the most effective specific teaching tools to teach and mentor compassion and humility to students who are preparing to work in a country that is not their country of origin? And in terms of pre-departure training, what are specific strategies that help to ensure that every participant will demonstrate cultural competency?
Yeah. So in terms of this question, this is a tough one because one of my colleagues mentioned, that you can't necessarily forecast how someone will behave on the ground. So in that vein, preparation is really essential in fostering these sensibilities. And if we think about culture as a kind of operating system for people and organizations, it's akin to playing the same game but with different rules. And so if we can't teach the rules, we can at least try to teach students how to manage in an uncertain space. And so a couple of ways that we do it here at Vanderbilt is we, utilize online training modules. So we've created our own, utilizing resources at our institution, international experts, students who participated in programs before, those who are involved with international organizations who have unique experiences and insight to share. And then we also use existing online training modules and resources. You mentioned Unite for Sight's Cultural Competency online modules at the beginning of this webinar, and that's a fantastic resource among others. We also utilize case studies in the literature. And one of the things, to Jana's point of talk, is that unless we find that our students are engaged in these difficult conversations and scenarios, it's very hard to imagine finding yourself in a situation where you may be offending your partners, where you may be unexpectedly undermining the initiative or the intervention. And so we utilize case studies, many that are available online, but also we ask students to develop case studies based on their experiences, and we use those as real practical case studies for our courses. We also utilize students for panel discussions. We have students who participated in these experiences in the past and have found them to be just a wealth of resource for students to understand from a peer-to-peer perspective and imagine how they might overcome or address challenges that relate to culture, among other things. And then while students are abroad, we try to provide mentorship and safe spaces for reflection. And so that can be, helping them to identify individuals on the ground if we don't have our own staff and faculty on the ground, but finding partners who can help them reflect and work through their experiences, some of the things that have been mentioned on this webinar, or we actually Skype in with them to provide that safe space for reflection. And then just as essential is having debrief sessions when they return.
Thank you so much, Marie. And Jana, when hiring staff or accepting volunteers, how can an organization ensure that the individual is going to be culturally competent?
Yeah, I touched on this a little bit before, but and just to build on some things that my colleague said is you can't ever really ensure that. And for us, it goes back to that framework of trust. What you need to do is ensure that you hire people that you think you can trust and don't immediately thrust them into situations where cultural incompetence could lead to serious repercussions. From there, it's more of that long-term process that I mentioned. The framework that they are walking into needs to be culturally competent, or else all of the competence in the world on the individual's part won't matter. At Ubuntu, we made plenty of mistakes in the beginning. We wanted to hire and empower locally, but ran into an abundance of challenges. It was great to hire staff that was extremely culturally competent, but we discovered we also were not always hiring and empowering people who were or could be competent. And our model is based on our theory of change that we must hire local and focus on capacity building in order to truly make an impact. That's the model I referred to, the build model. It provides a framework for those who know the community best to excel in their job. So we rarely do take on volunteers or staff from outside, but when we do bring on volunteers, we don't place intrinsic value on where they're from. We vet them for skill set and usefulness to our organization and to the community itself, and we make sure that that person has the experience and the competence to assist our organizational gaps. We identify gaps within our staff and where we need technical assistance, and then might bring somebody down who can fill that gap, assist us for a period of time as a mentor or a coach, and then move on, because that's what's culturally competent, ensuring that the skills are transferred to our local staff. So, going back to my point, you can never ensure that someone is culturally competent. I do hold a series of interviews and work with that person, and touching on Marie's point, we try to prepare them and before we bring them down to our site, and I engage with them enough to know that they're flexible, patient, humble, have that sense of humor that we talked about, and have the experience required.
Thank you so much, Jana. And Marie, sometimes cultural competency is viewed as a buzzword. How do you ensure that students and colleagues are taking cultural competency seriously? And also, is there a way to concretely evaluate or assess cultural competency skills?
Well, this is a great question. There's certainly different tools that exist for assessing cultural competency. Some have more limitations than others, but, to a certain degree, it's creating your own criteria, much to what Jana was pointing to. Do they exhibit flexibility, humility in their exchanges with you, and could you imagine that transferred amongst community on the ground? And remind me of the first part of the question, Jennifer.
Yes. How do you ensure that students and colleagues are taking cultural competency seriously?
Yeah, this is great. And so importantly, that can emerge through a conscientious integration into the curriculum and into lectures and discussions that are held with the students. So if I think about it from an academic perspective, integrating those in the class where you think about intentional thought and reflection placed on it. If I hearken back to some educational theorist, John Dewey, discussed education as being educative or miseducative. So without intentional thought and reflection, you can have these experiences that actually aren't necessarily beneficial for the student or for the community by extension. And so it's the role of the faculty and the staff to really embrace the tenets of cultural humility and recognize that without it, we'll never have a successful intervention. These top-down, top-heavy, coming in with the ideas that we assume are the best, those haven't borne out to be successful in the past. And so thinking about new models and looking at best practices of organizations like the ones on this call who really have walked alongside organizations to build programs from the ground up collectively.
Excellent. Thank you, Marie. And another question for you, Marie. Oftentimes, culture shock hinders even the most well-prepared people in a new environment. How can travelers be best prepared for culture shock, and what tools can help them to navigate their own feelings while maintaining humility with the new community?
So this is a great question. On a recent trip I took this summer, I realized that culture shock also occurs later in life, even after you've had many experiences in different countries. So much like cultural competency, it's knowing the process is important. So understanding the phases, there's some clearly identified phases of cultural competency, and being aware of those before you find yourself in a situation can be very empowering. To recognize where you might fall throughout the spectrum is helpful. And having a support system is really critical on the ground, knowing who you can turn to as a resource and someone that you can vet ideas or brainstorm or really work through the feelings that you're having. Learning about your host country before you go is really helpful. Trying to imagine the cultural nuances that you might encounter if the country has a high prevalence of HIV, what kinds of experiences might you have? What might you see on the streets? And there's no way to totally prepare for your experience, but you can prepare by at least doing, research on where you're going and what it might look like and what kinds of descriptions in the literature are available. And then recognizing that once you're back, you also have culture shock. So this is not unique to being abroad. It's something that you can experience in the reverse. And so seeking out the resources and the toolkits are really essential in moving you into a good productive space.
Thank you, Marie. And Dean, do you have any additional thoughts about this question regarding culture shock?
I'm blown away by this panel. I think there's so much. Any one of us could have gone, like an hour flying solo. So I really can't add anything. But see, I also been doing this now since 1976. So I still get culture shock too, but I don't know how to analyze it any differently than people have commented. So I'd have to say no. And I give my 2 minutes to anybody who wants to add something along those lines.
Terrific. Thank you, Dean. And Paul, how do you incorporate cultural competency into technology ventures? How do you bridge the gap between an advanced technology and the local community where it's intended to help?
So this is an interesting question for me. First thing that I'd say, Jennifer, is that not only is cultural competency not static, it's also multidimensional. So when you start to consider, the dynamics of age, of socioeconomic status, of technical prowess, all of that layers on top of the cultural competency. I think one of the fallacies a lot of us assume is that innovation, and particularly technology innovation, flows from places like Silicon Valley, to quote unquote developing markets. When in fact, what I think probably most of us on the call have realized firsthand is that some of the most phenomenal innovation, including technology innovation, is actually happening in some of the most, resource constrained or resource, poor areas. So in terms of sort of the idea of advanced technology and that sort of, awareness, on the ground in the communities, where we're doing projects, again, I think it's really important to not assume that, we've got to sort of dumb down the technology or step back, 5, 10, 15 years. One of the elements that I've been particularly, proud and privileged to be a part of is, working with groups like Partners in Health, like Clinton Health Access Initiative, where the mindset is, we're going to develop leading edge technologies. For example, the Mirabile Teaching Hospital in Haiti with Partners in Health, new cancer treatment center in Rwanda. These are leapfrogs in technology and innovation, coming out of what, people would have assumed to be very resource constrained, very, technology lagging, countries, when in fact they're not. They're some of the best, ones in the world. So again, I think it's, it's probably a surprise to some people of, again, go understand the situation, understand, what the problem is and, what the resources available are, and approach it that way, as opposed to, I think it's interesting right now with Facebook saying that, they've announced they're going to have their folks in California, working off of a 2G instead of a 4G app development, for an hour a week. The reality is some of the really phenomenal technology innovation is actually happening, in developing markets.
Great. Thank you, Paul. And for our final question for Natacha, what are examples of visual messages which were assumed to be communicating one message but actually were causing harm in the field? How could the issue have been avoided?
Well, I know we are running out of time, so I'll try to be as brief as possible because this question can extend for a long time. The idea of developing a visual message developed for an urban population will most likely be misunderstood by the rural, often illiterate population because they have different ways of perceiving images. Their understanding will depend on their upbringing, their culture, their past experiences, and their living environment. So there are many projects that fail to communicate effectively because they were not tested with the intended audience. So a key to effective communication is to always test your ideas with the actual people who will benefit from these designs or products. I have seen projects created out of good intentions that fail because the designers made wrong assumptions or shortcut field testing within the target population. For example, using colors such as green and red to imply okay and stop is a cultural reference to traffic lights that are commonly found in urban areas, but they are absent in remote rural areas where electricity is not available. Similarly, using speech bubbles that are recognized by youth who are familiarized with comics, but rural youth will misinterpret them because they will see them as clouds. Another fail that is actually mentioned in the Unite for Sight certificate is the idea of using an X over an object to communicate prohibited or do not do. Because that's mostly misunderstood. It's mostly understood in Western societies, but in rural areas, people usually see this message as a stop, not as a stop, but as a cross. And they will try to communicate the idea of stop or not to do something with hand gestures, like to open hands waving. So the important point to make is that any communication decision should always be made through a user-centered design process and test with your intended audience. That's what I would suggest how to avoid it.
Wonderful. Thank you so much, Natacha, and thank you to all of our panelists for this phenomenal conversation about cultural competency. This brings us to the end of the webinar. Thank you again to all.
Thank you.
Thank you so much.
Thank you.